Hi, my name is Valentina and I'm a clinical counselor here with the Mood Disorder Association of British Columbia, and I will be talking to you today about EMDR therapy. Before we talk about what EMDR therapy is, we first should talk about and identify what the trauma response is. After a trauma, people go through a wide range of normal responses. Such reactions are experienced not only by people who are involved in the trauma firsthand, but often also by those who have witnessed or heard about it or have had different kind of involvement with the person or persons immediately affected. Many new reactions tend to be triggered by persons, places, or things associated with the trauma. Some reactions may appear totally unrelated. And now I'll give you a list of common physical and emotional reactions to trauma, as well as a list of some helpful coping strategies. These are normal reactions to abnormal events. So some of the normal physical reactions to trauma are aches and pains like headaches, backaches, stomach aches, sudden sweating and or heart palpitation, changes in sleep patterns, appetite, interest in sex, constipation or diarrhea, easily startled by noises or unexpected touch, more susceptible to colds and illnesses. Some of the normal emotional reactions include shock and disbelief, fear and anxiety, grief, disorientation, denial, hyper-alertness or hypervigilance, irritability and or restlessness, outbursts of anger and rage, emotional swings, flashbacks, feeling like the trauma is happening now, feelings of helplessness, of panic, tendency to isolate oneself, feels detached, concerns overburdening others with problems, emotional numbing, restricted range of feelings, or difficulty trusting, or feeling betrayed, and on and on and on. There are a lot more physical reactions associated with trauma, and all of them will be normal. So what are some helpful coping strategies that people can do to mobilize themselves? Well, one of them will be to initiate some kind of a support system. Reaching out and connecting with others, especially those who may have shared the stressful event. Talk about the traumatic experience, cry. Hard exercise like jog, aerobics, bicycling, walking, relaxation exercises like yoga, stretching, massage, humor, prayer, meditation, hot baths, music and art. There is a necessity also for a balanced diet, much sleep as possible, avoidance of caffeine, sugar, nicotine, commitment to something personally meaningful, even things like hugging some of those that you love. So everything that nurtures your being will be something that you can use as a helpful coping strategy. In 1987, while walking in a park, Dr. Francine Shapiro made a change observation. She noticed the intensity of her disturbing thoughts and feelings reduced after her eyes had been moving rapidly back and forth. Being a student of psychology and a naturally curious person, she decided to research this for her doctoral thesis. She found a way to use rapid eye movements in a special psychotherapy protocol and discovered it was very successful in relieving chronic distress in victims in trauma. By 1989, Shapiro had developed a totally new kind of psychotherapy, EMDR therapy. So what is EMDR? EMDR is a new psychotherapy used to treat troubling symptoms such as anxiety, guilt, anger, depression, panic, sleep disturbance, and flashbacks that are the result of traumatic experiences. Traditional therapies have met with limited success in treating victims of trauma. Not only has EMDR therapy been proven effective in reducing the chronic symptoms which follow trauma, the therapy benefits appear to be permanent. Since Dr. Shapiro first published her research in 1989, EMDR has developed and evolved through the contributions of therapists and researchers all over the world. It now incorporates elements from many different treatment approaches. To date, it has helped an estimated 500,000 people of all ages receive relief from many different kinds of psychological distress. Eye movements. Much has been learned about this therapy since the day it was named for eye movements. Now it appears that the beneficial effects are facilitated by alternating stimulation on the right and left hemispheres of the brain. Eye movements accomplish this, but they do bilateral alternating taps and tones. Desensitization refers to the removal of the emotional disturbance associated with traumatic memory. Reprocessing refers to the replacement of unhealthy negative beliefs associated with traumatic memories with more healthy positive beliefs. So EMDR stands for Eye Movement Desensitization Reprocessing Therapy. There are two types of trauma, big T trauma and little t trauma. Big T traumas are the major horrific events like combat, rape, or the loss of a child. Little t traumas are the smaller, everyday chronic horrors like daily negative childhood messages leading a girl to grow up believing she will never be good enough. EMDR can help heal both types of trauma. EMDR therapy can be a very intense emotional experience temporarily. It is not appropriate for those who are unwilling or unable to tolerate highly disturbing emotions. An EMDR therapist must take a thorough history to determine if and how EMDR can be used as part of an overall treatment plan. EMDR has been successfully used to treat many problems. Some of those include post-traumatic stress disorder, anxiety, depression, phobias, complicated grief, sexual abuse, panic attacks, dissociative disorders, phantom limb pain, peak performance, performance anxiety, addictions. This depends on several factors, including the nature of the problem being treated, the client's history, and the client's ability to tolerate high levels of disturbance. In some cases, one EMDR treatment session is enough. Usually it takes weeks to months, but sometimes years of treatment are required. When EMDR therapy is used appropriately, it can significantly shorten the overall length of time in therapy. First, client and the therapist work together to collect basic information about the traumatic experience. The most disturbing part of the experience is identified and becomes the processing target. For example, image of the rapist's face. The negative belief connected to the trauma is identified. For instance, never get over this. And a preferred possible belief is named. For instance, it's over. I can move on with my life now. Next, client is asked to rate on a scale of 1 to 7 how true the positive belief feels when paired with the target. Usually it does not feel very true at this point. Client is asked to name the emotions the target elicits and then the rate of the associated distress level on a scale of 0 to 10 and to locate the disturbance in the body. For example, fear and shame with disturbance level 2 in belly and chest. Then the client is asked to quote in awareness the target, the negative belief, and the disturbing body sensations. At the same time, the therapist guides the client's eyes to move rapidly back and forth. This is done in sets, which may last from few seconds to few minutes. During each set, the client is instructed to just notice whether changes occur in mind and body without controlling the experience in any way. Very often, in the first few sets, there is an increase in the disturbance level. After a while, with each new set, the target becomes less and less disturbing and the positive belief feels more and more true. The target is completely processed when recall of the image no longer brings up disturbing emotions and the preferred positive belief feels totally true. For example, client recalls the rapist's face was threatening but does not feel threatened by the image anymore. EMDR is now the most researched treatment for post-traumatic stress disorder. EMDR and frequently asked questions. Eye movement desensitization and reprocessing is a non-drug, non-hypnosis psychotherapy procedure. The therapist guides the client in concentrating on a troubling memory or emotion while moving the eyes rapidly back and forth by following the therapist's fingers. This rapid eye movement, which occurs naturally during dreaming, seems to speed up the client's movement through the healing process. EMDR is used to treat troubling symptoms such as anxiety, depression, guilt, anger, and post-traumatic reactions. It can also be used to enhance emotional resources such as confidence and self-esteem. EMDR is different for everyone because the healing process is guided from within. Sometimes past issues or memories come up which are related to the current concern. Sometimes a painful memory brings up an unpleasant emotion or body sensation. This is normal and generally passes within a few minutes or long as EMDR is not stopped. The upsetting emotion or memory often seems to fade into the past and to lose its power. When painful memories are avoided, they keep their disturbing power. However, a flashback or nightmare can feel as upsetting and overwhelming as the original experience, yet not be helpful. In therapy and with EMDR, you can face the memory in a safe setting so that you don't feel overwhelmed. Then you can get through it and move on. It is hard to predict the thoughts, feelings, or memories that may come up during EMDR. It depends upon each individual's natural healing process. You are always in charge of whether to continue or stop. You can also decide how much to tell the therapist about the actual experience. Yes, there are specific procedures to be followed depending on your presenting problem, emotional stability, medical condition, and other factors. It is very important that the therapist be formally trained in EMDR. Otherwise, there is a risk that EMDR would be incomplete, ineffective, or even harmful. You may continue to process the material for a few days or even weeks after the session, perhaps even having new insight, vivid dreams, strong feelings, or memory recall. This may feel confusing, but it's just a continuation of the healing process and should simply be reported to the therapist at the next session. However, if you become concerned or distressed, you should call your therapist. As the distressing symptoms fade, you can work with a therapist on developing new skills and ways of coping. If you're interested in getting EMDR therapy, my name is Valentina and I'm trained in EMDR, and you can receive it here at the MDABC Wellness Center. Thank you very much.